Good evening. This is Beverly John reporting from Afro-Mosaic Health Guide World Health Watch. The end of the Ebola transmission in Guinea marks an important milestone in the Ebola outbreak in West Africa. The original chain of transmission started 2 years ago in Guinea, Guinea in late December 2013 and drove the outbreak, which spread to neighboring Liberia and Sierra Leone and ultimately by land and air travel to 7 other countries. This is the first time that all 3 countries, Guinea, Liberia, and Sierra Leone, have stopped the original chains of transmission that were responsible for starting this devastating outbreak 2 years ago. Dr. Matshidiso Miti, WHO Regional Director of Africa, stated that he commended the governments, communities, and partners for their determination in confronting this epidemic to get to this milestone. As we work towards building resilient healthcare system, we need to stay vigilant to ensure that we rapidly stop any new flares that may come up in 2016. In addition to the original chain of transmission, there have been 10 new small Ebola outbreaks or flares between March and November 2015. These appear to have been due to the re-emergence of a persistent virus from the survivor population. Among the challenges survivors have faced is that after recovering from Ebola virus disease and clearing the virus from their bloodstream, the virus may persist in the semen of some male survivors for as long as 9 to 12 months. WHO and its partners are working with the governments of Liberia, Sierra Leone, and Guinea to help ensure that survivors have access to medical and psychosocial care, screening for persistent virus, as well as counseling and education to help them reintegrate into family and community life, reduce stigma, and minimize the risk of Ebola virus transmission. The coming months will be absolutely critical, says Dr. Bruce Aylward, Special Representative of the Director General for the Ebola Response, WHO. This is a period when the countries need to be sure that they are fully prepared to prevent, detect, and respond to any new cases. The time-limited persistence of virus in survivors, which may give rise to new Ebola flares in 2016, makes it imperative that partners continue to support these countries. WHO will maintain surveillance and outbreak response teams in the 3 countries through 2016. At the same time, 2016 will see the 3 most affected countries implementing a full health sector recovery agenda to restart and strengthen key public health programs, especially maternal and child health, while continuing to maintain the capacity to detect, prevent, and respond to any flare-up of Ebola. WHO commends the government of Guinea and its people on the significant achievement of ending its Ebola outbreak. WHO has said we must render homage to the government and people of Guinea who, in adversity, have shown extraordinary leadership in fighting the epidemic. This is Beverly John reporting from Afro-Mosaic Health Guide World Health Watch.